Panic disorder can be such an isolating experience, right? It feels like you're caught in this terrifying storm that no one else can see. So today, we're going to pull back the curtain on that storm, what it is, who it affects, and most importantly, how to find a way out of it. Let's dive in.
I want you to imagine this for a second. You're just going about your day. Maybe you're sitting at your desk or walking through the grocery store, and then, bam, out of the clear blue sky, this overwhelming wave of pure terror just crashes over you for no reason at all. That feeling, that's the entry point to understanding what a panic attack is all about. So what does it actually feel like? Let me tell you, it's way more than just feeling anxious. We're talking a full body takeover. Okay, so it usually kicks off with your body just going haywire. Your heart starts pounding, hammering against your ribs, so fast you're convinced something is seriously, terribly wrong. And then you can't breathe. It literally feels like you're choking or suffocating. And it doesn't matter how hard you try to gasp for air, it just feels like it's not enough. And that's when your mind just spirals, because those physical feelings, they're so intense, so overwhelmingly real, that you're not just worried you're having a heart attack. You are convinced of it. You feel like you're about to die, right there in that moment. It's not a what if, it feels like a fact. Okay, so let's put some clinical language to that terrifying experience. Basically, a panic attack is this sudden, intense wave of fear that hits its peak in just a few minutes. And all those things we just talked about, they're here. The pounding heart, the sweating, shaking, feeling short of breath, even that terrifying fear of losing control or, as some people put it, going crazy. Okay, but here's something that's really important to understand. Having a panic attack, which, by the way, about 1 in 10 adults will have at some point, is not the same thing as having panic disorder. The real difference is what happens after the attack is over. And this chart breaks it down perfectly. Think of a panic attack like a single lightning strike. It's one intense event. Panic disorder, on the other hand, is the whole thunderstorm that follows. It's when you have these attacks again and again, and they're unexpected. That's the key word. And then, for at least a month, you're living in constant fear of the next one. That fear is so powerful that it actually makes you change your whole life just to avoid another attack. So who is most at risk for getting caught in this cycle of fear? Let's take a look at the data. So in the United States, about 2 to 3% of people will experience panic disorder at some point in their lives. Now, that number might sound small, but think about it. That's millions and millions of people. And interestingly, the data shows a pretty clear gender gap. The condition is diagnosed in women about twice as often as it is in men. And when does this usually start? Well, for most people, it kicks in during early adulthood, right around that 20 to 24-year-old age range. Now, an attack can feel like it comes completely out of nowhere, but researchers have found some common risk factors. Things like, difficult experiences in childhood, smoking, or going through a major life stressor a few months before it starts. These can all make someone more vulnerable. So, we've talked about the attack itself, but the impact of the disorder, wow, it reaches so much farther than just those few terrifying minutes. It can truly change everything about a person's life. Yeah, for a lot of people, this isn't something that just goes away quickly. It tends to be a chronic thing, meaning it can come and go, its intensity can ramp up and then fade over a person's lifetime. And this is a really big deal. Panic disorder almost never shows up alone. It often coexists with other conditions. And if you look at this chart, the biggest slice of the pie, by far, is major depressive disorder. We're talking 30 to 40% of cases also involve depression. And this really shows you the ripple effect of the disorder. It's not just about the attacks themselves. It's about the constant shadow they cast over everything. It's about avoiding places you used to love because you're scared. It's about the strain it puts on your relationships. And tragically, all of this leads to a higher risk for suicide. It's incredibly serious. Okay, I know that all sounds incredibly heavy, and it is. But now we're getting to the most important part of this whole conversation, because here's the good news, the really good news. Panic disorder is absolutely 100% treatable. There is a clear, well-established path to getting better. I love this analogy. It's just perfect. It completely reframes the whole thing. It says, hey, this isn't a character flaw. It's not you being weak. It's like your body's alarm system, its fear response, is just way too sensitive. A tiny little breeze is setting off the whole car alarm. It's a false alarm, but man, does it feel real. And because the symptoms feel so physical, chest pain, dizziness, trouble breathing, the absolute first, most crucial step is to get a proper diagnosis from a doctor. They need to make sure it's not something else, like a thyroid issue or a heart condition that's causing these symptoms. So once a doctor has ruled everything else out, the path forward is actually very clear, and it's backed by tons of research. It usually comes down to psychotherapy, medication, or sometimes a combination of both. So let's look at the specific tools that we know work. First up is psychotherapy, and the gold standard here is something called cognitive behavioral therapy, or CBT. This is all about learning to recognize and challenge those catastrophic thoughts that fuel the whole cycle of fear. Then you have medication. Things like SSRIs are proven first-line treatment that can really help dial down the frequency and intensity of the attacks. The bottom line is there is real, effective, evidence-based help out there. So that brings us to this final question. If we can start seeing panic for what it is, not a personal weakness, but a treatable false alarm in our wiring, how does that change the conversation? How can that simple shift in perspective help us break down the stigma and maybe, just maybe, encourage someone who's suffering in silence to finally reach out and get the help that we know really works?